Delegation in nursing. First, let's talk about delegation. What exactly is delegation? Well, delegation is when the delegator assigns specific tasks to be completed by another individual. This has to be done in nursing using the 5 rights of delegation. So the 5 rights of delegation include right task, right circumstance, right person, right direction and communication, and right supervision. All of these have to be included to make sure that the task that's being delegated is appropriate for the person completing it. So let's talk about the right task. This task needs to be legally delegated, meaning that the task itself should be within that person's scope of practice. Also, with the tasks, they have to be appropriate for the individual who will be completing it. That means that that person needs to have the experience and skills necessary to complete the task safely. What about circumstance? Well, right circumstance, what makes this easy? The need for the task to be completed, a patient being appropriate for the task that's being delegated, making sure that the environment and the patient is safe during the completion, appropriate supervision. So either if the task needs to be supervised by the nurse, then that nurse needs to be available to supervise the individual completing the task. And also, the nurse needs to be able to monitor the patient that the task is being performed on, as well as having feedback being given back to the nurse after the task is completed. And resources. The individual that's completing the task needs to have all the resources available to complete this task safely. What about the right person? How do you choose the right person to complete your task? Well, they need to have the experience and skills necessary to complete it safely. It needs to be within their scope, meaning they have to be able to legally complete this task in their scope of practice. And there should be communication between the delegator and the individual completing the task, ensuring that the individual completing the task is comfortable in doing so. Which leads us to right direction and right communication. The task that's being completed needs to be explained to the individual completing the task and direction being given to them. Many facilities have protocols for multiple procedures and tasks that are performed daily. This protocol should be provided to this individual so that there's no question or concern and that there's an understanding of what is to be completed. And right supervision. The right supervision is the nurse that will be supervising the individual that is completing the task. It's also making sure that the individual has the appropriate resources and understands the directions for the task and is comfortable with the task as well as monitoring the patient that the task is being performed on. Also, this nurse or the nurse or the delegator that is assigning the task to be completed, they're responsible for ensuring that this task is completed and completed safely.